Hi everyone, this is Dr. Sukesh Rao Sankineani, consultant shoulder and knee surgeon at Yashoda Hospitals, Secunderabad. I often come across this question, Doctor, I have had a meniscal tear and meniscectomy done, that is complete removal of the meniscus, and I continue to have knee pain. What should I do? Do I have any treatment options left? The answer to that is we do have treatment options left. Previously, all these patients were condemned to suffer the pain and were let to go on their own. But now there is a revolution in meniscal surgery called as meniscal replacement technology, in which we take meniscus from a dead patient, that is called as an allograft, and we do meniscal allograft transplantation in these patients. The essential criteria is the patient should be young, patient should have a normal alignment of the leg, and he should not have any associated ligament injuries. So when these criteria are met, these patients undergo a meniscal allograft transplantation, which is transplanting a new meniscus into the knee joint, which will prevent the onset of arthritis in these patients. The other option, if you don't have an allograft, is called as meniscal reconstruction technique, wherein we take a small piece of muscle from the leg called as the semitendinosus or gracilis tendon. We use this tendon to reconstruct a new meniscus. So this new reconstructed tendon acts as a meniscus and helps in prevention of arthritis. So for anyone out there suffering with meniscectomy and knee pain, I think not all hope is lost. There are salvage options. So contact your doctor and get yourself treated at the earliest. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.